CES students. I'm Dr. Teo. Today I'm going to talk about the clinical process, which I promised you all that I will make a video regarding how we want to approach clinical cases. So for introduction, we have a set of ways when we see patients. So first, when patients come in, we obviously you think back when you see a doctor, what do? The first step, they will ask, how are you? That's building rapport. How are you? What brings you in today? So how are you? How have you been? And so on and so forth. So then we start off with asking, can you tell me more about your problem today? So this we are approaching into the history taking. Remember that by history taking, from research, it is said that 80% of diagnosis we can get it directly from history taking. So at the same time, it builds rapport. And for your information, history taking, whenever patient come in with a chief complaint, we do have a template for a set of questions we need to ask. But for you guys, maybe the simpler form will be adequate. You can use your logical thinking, or you can read from our websites online, or even from Geeky Medics YouTube channel. These are the resources that I use during my medical trainings. So as a family doctor, I believe that whenever we teach any clinical teaching, we use a case. So I'm gonna tell you about a patient, a 55 years old man, came into a clinic complaining of cough for 1 week, yellowish sputum, fever for 3 days, high grade in nature, having chills and rigor, and having shortness of breath. So you will realize that sometimes doctor even ask more than that, because at the back of our mind we are thinking of other diagnoses. So for me, I will ask, is this the first episode, or you have been having this cough and fever for a long time? Because I'm thinking of chronic infections or underlying cancer. So is it recurrent? Any constitutional symptom which are like loss of appetite, loss of weight, or this one, cough with blood, smoker, family history of similar problem. We can ask a lot of category of clinical history. So like I said, there's a template. If you're interested, please download the history taking format from online. Then you will learn more about it. But for basic, I think these are adequate how we approach patient. So after we listen to the patient, these are the complaint of respiratory problem in our previous case. So what type of question, what type of examination we want to do? Of course, the general one will check the blood pressure, heart rate, the height, and the weight of patient from the triage counter or the screening counter. So at this point of time, of course, I would like to do a chest examination. Chest examination which can be consist of cardiovascular system and respiratory system. So for this case, I will focus on respiratory system. I would like to auscultate the lungs. So you see the correlation. If in this case, rather than you check the lungs, you go and examine the abdomen, you palpate the abdomen, auscultate the abdomen, then it will become redundant, and it may be related, but that's not the main thing that we want to examine. So remember that the examination will correlate with the history that we took. After the history taking and physical examination, doctors usually will have some idea of what patient has. So from that patient, when I listen to the history, I listen to the lungs, it seems like more like about infection. So at the back of my mind, pneumonia, or other, it can be virus, it can be bacteria. So this is what we call as differential diagnosis. But there are diagnoses not to be missed, like cancer, which that's why we ask the question in history taking to try to rule out that cancer is unlikely. But what I want to inform you all is that differential diagnosis is the possible causes of the patient presenting problem after we examine the patient. So some doctors would like to list it down from the most likely, most probable diagnosis to downwards to the diagnosis that not to be missed. This is according to our family doctor's principle using John Mocktuck approach to patients. And differential diagnosis, sometimes we only get after we have some basic investigation. So depends on the doctors himself. They want it to be after physical examination or after investigation. For like some doctors, they may even have differential diagnosis from the history alone. So then we have a differential diagnosis. We want to rule in or rule out. We may need to do X-rays, which is we call as radiological examination or lab tests, or some other form of investigations. So for that case, sometimes I don't even need investigations. We can treat it clinically, but for some doctors outside, they will prefer X-ray or a blood test. So depending, it's not like a hard or fast rule. So after all that done, then we get a provisional diagnosis, the most likely diagnosis after considering all the information gathered. So this is provisional diagnosis there, whereby we doctors act on it and how we want to treat it. So like I said, after the provisional diagnosis, we can decide on modalities of treatments. So either is a non-pharmaco, reassurance, physiotherapy, counseling, or pharmacological treatment. So for that case, I think fine observation and clinical examination, I think there's a need of antibiotic, then I give antibiotic and tell them how to take the antibiotic and for how long it is. So for some other case, for other cases may need surgery, then we will refer for hospital care. So in summary, the clinical process is from history taking, then we move on to physical examinations, which are related to the presenting problem. Then we have a set of differential diagnosis. These the strength and the list of differential diagnosis will depends on your knowledge, your background knowledge, how much you know about certain diseases. Then we move on to investigation to confirm or to exclude certain diagnoses. Then we get to our final diagnosis, which we can treat on and then monitor. So remember that this video that I'm doing is for you to know the clinical process and the thought process of doctors when we see patients. It's very important for you guys in CES because some of you may not be from clinical background, who are lab based or science based. So with this video, I hope that it can help you in having the thought process needed for you to approach your problem-based learning and even approach your patients. Because remember, CES is Clinical Exercise Science, the clinical words, meaning that you will be seeing patients in the future and servicing them. So if you have any question, guys, don't hesitate to post in our forum, our e-learning. And if you like this video, please click subscribe and like and share it if you want, so I can produce more video to share with you guys soon. So see you guys in the next class. Thank you.